So hello friends, so today I am going to make a video on the topic a monocyte macrophage cell system, or this is also known as reticuloendothelial system. So first of all, that you should know that this is a blood vessel and this is a monocyte, and this is a tissue, and here that inside this tissue these are the cells and these are the tissue spaces. So here it is a normal situation, but suddenly so let that suddenly that is a foreign particle, that is a foreign particle enters. So here this is a foreign particle, so here a foreign particle enters, and this foreign particle so here causes infection, and here and this so if infection is done, so then in a response, so therefore inflammation will be done. So therefore for inflammation is done, so then automatically that is monocytes will undergo so here a diapedesis to come out of the blood vessel, and through the process of chemotaxis, so here and that monocytes will go towards the inflamed tissue. So therefore now you are able to see that that is monocytes, that is when enter into the tissue spaces become macrophages, and now that these macrophages that they are mobile because they can move here, they can move here, and they have been derived from monocytes which are mobile, and they are not initially attached to the tissues, so therefore that these are mobile macrophages. But you can see here that from a starting point that there are some macrophages that which are attached to the tissue or to the cells of the tissue, and these are known as fixed macrophages. So therefore, so two types of macrophages, mobile macrophages and fixed macrophages. So now I am going to write that is what is a monocyte macrophage cell system, or that is reticuloendothelial system. So friends, so now I have written that for this monocyte macrophage cell system or reticuloendothelial system, so here that it is a combination of mobile macrophages, it is a combination of so here mobile macrophage, and here fixed macrophage, and here monocytes, and this is written in your book guide. So friends, see the total combination of monocytes, mobile macrophages, fixed macrophages, and a few specialized endothelial cells in a bone marrow, spleen, and lymph nodes is called a reticuloendothelial system. And here and this explains so here the difference between the so here mobile macrophages and fixed macrophages. And here basically, and this also shows that is fixed macrophages have also so here properties similar to that so here mobile macrophages, but only difference is that this mobile macrophages they are derived from the monocytes, whereas these fixed macrophages they are so here present in the tissues or cells from the starting point or from the initial or from a longer period of time, though they are derived from the monocytes. So friends, so here that this is a lung, so here that you should know that this is a lung and this is a alveoli, and here that and you can see here that is a zoom portion alveoli, that you can see here that in the wall of alveoli, so here some fixed macrophages they are present, and you know that that through breathing, that is through air, so here air comes out in the alveoli from this route, but here that is, and in the alveoli basically some particles may be present, and these particles get trapped in the wall of alveoli, and then so here then these fixed macrophages so here do the phagocytosis or the killing of this entrapped so here particles in the alveoli, and this is mentioned in your book also. So see friends, that is A large number of tissue macrophages are present as integral components of the alveolar walls. They can phagocytosize particles that become entrapped in the alveoli. So now I'm going to discuss how the fixed macrophages of alveoli, so here kill the digestible entrapped particles and non-digestible entrapped particles. So first of all, that you should see here that this is the so here that this is the entrapped particle and this is the macrophage. So here that this macrophage is here engulfing this entrapped particle, and here and this entrapped particle is inside the body of macrophage. So therefore that inside the body of macrophage digestion is going on, and finally that is after the digestion, that is the digested product is released into the lymph, or here basically in the lymph vessel. So here, and this is written in a book also, so here if the particle is digestible, the macrophages do the digestion and release the digested products into lymph. Now here that is if the particle is of digestible, so here this is the particle which is to be phagocytosed or killed, and this is the fixed macrophage. So here that in this case that it is forming a giant capsule around the particle. So here like that, if the particle is non-digestible, the macrophages form giant capsule around the particle. So this is mentioned in a book also. What is written? So here if the particles are digestible, the macrophages can also digest them and release the digestive products into the lymph. If the particle is not digestible, the macrophages form a giant cell capsule around the particle until such time it can slowly dissolve, and such frequently form. So here form around tuberculosis, bacilli, silica dust particles, and even carbon particles. So friends, so now I'm going to explain about the macrophages in the liver sinusoids. So here you all know that in the intestine of GIT, digestion completes, and then the blood goes into the liver through the portal vein, and then it goes into the general circulation. But in liver, that this blood passes through liver. But in liver, this blood passes through liver sinusoids, and these liver sinusoids lined by macrophages. If any like that bacteria or foreign particles or infectious particles present in this blood, then they are killed by these macrophages, so that only pure blood goes into general circulation. So therefore that is what the portion I have written. After digestion, the blood containing the absorbed food components going to the liver through the portal vein. In liver, the blood passes through sinusoids of liver and the macrophages, and these macrophages kill the foreign particles present in the blood to allow only pure blood in the general circulation. Now so here same thing explained in your book also, but in different languages. I'm going to show this. So now so you can see here that and another route by which bacteria invade the body is through the gastrointestinal tract. So large number of bacteria from ingested food constitute faster GIT mucosa. So here before this portal blood enters the general circulation. Before this blood enters the general circulation, so here it passes through liver sinusoids, which are lined by tissue macrophages called Kupffer cells. And these Kupffer cells form an effective particle filtration space that almost none of the bacteria from the GIT passes from the portal blood in the general circulation. So this is all about it. So now I would explain about the macrophages in the lymph node. So first of all, that this is a tissue, and here that these are the cells as I mentioned, and this is the foreign particle, and this is the lymph vessel, and this is the lymph node, and this is the macrophage. So here so just consider that this foreign particle has entered into a lymph vessel. Now here, and from the lymph vessel, that this foreign particle will go into the lymph node, and in the lymph node there are some macrophages, as I mentioned, are present, and these macrophages kill the any foreign particles entering in the lymph node. And this is the main concept that I am going to explain. Now I am going to write this also here. So friends, so that explain portion, diagram portion I have written. So here from tissues, foreign particles, so here bacteria enters the lymph vessel, then from, so here enters the lymph vessel, then from lymph vessel, so here it goes into the, so here lymph node, and then in a lymph node the line macrophages, so here kill the bacteria and the foreign particle. And the same thing also is mentioned in your book also. So you have basically macrophages in the lymph node, and here it only explains about a lymphatics, afferent lymphatics, hilus, and these things we also study in anatomy also, but this is the main. They enter the lymph and flows the lymph nodes. Okay, so here located intermittently along the course of lymph node. The foreign particles trapped in these nodes and meswork of sinuses lined by tissue macrophages. So now I am going to explain about the tissue macrophages in the skin and subcutaneous tissue. So therefore, especially in the subcutaneous tissue. So this is the skin and this is the subcutaneous tissue, and here it is a macrophages lining subcutaneous tissue. So here if any foreign particle like that, if any yes, in this it enters, so here basically foreign particle or infectious agent, so here, and then so here, so in for inflammation, that is defective inflammation, that is macrophages kill the, so here, infectious agent. Now I am going to write this in my language, you can also write this. So therefore that same portion I written, that is infectious agent attacks the subcutaneous tissue to cause injury, and these macrophages destroy the infectious agent, and this same thing mentioned in your book. So therefore like that, when infection begins in a subcutaneous tissue and local inflammation occurs, so local tissue macrophages can divide in situ and form still more macrophages, and then they perform the usual functions of attacking and destroying the infectious agents. Simple. So friends, so now I am going to discuss about the macrophages of the spleen. So now that you see here that this is a artery, this is a large artery, and this is a small artery. Sorry, wait, please. This is a large artery, and this is a small artery, and this small artery enters this splenic pulp through the splenic capsule, and then this a small artery that is terminates into small lighted arterioles, and then it so this are capillaries, and then through these capillaries, so here they are going to the, so here venous urethra, but here any through these capillaries, that this goes in the cords of red pulp. So this is the red pulp cords. So here cords of red pulp, and here, and you can see here that these cords of red pulp also lined by macrophages, and these macrophages, so here is a cords of red pulp and macrophages, and these macrophages also kill foreign particle present here, so that is pure blood goes into this venous circulation, and this is written in your book. So you can see here that is a small artery penetrates from a splenic capsule into a splenic pulp and terminates in small capillaries. The capillaries are highly porous, allowing the whole blood to pass into cords of red pulp, and this blood transcutaneous to a trabecular meshwork of, and this trabecular meshwork of these cords, and eventually return to the circulation of venous sinuses. The trabeculae of the red pulp and the venous sinuses, that the trabeculae of the red pulp and the venous sinuses. So now so this is the main thing, that is it is lined with macrophages, and this macrophages also that is do the, so here purification of the blood. So that's all about the reticuloendothelial cell system. Thank you.